do my third speech on kidney failure. There are many causes of kidney failure. These may include hypertension, which is high blood pressure, uncontrollable diabetes, complications during pregnancy, and maybe even an autoimmune disease. Kidney failure may also be acute, which may be caused by losing function of your kidneys due to an auto accident or ingesting foreign toxins like alcohol, or from drinking moonshine, most commonly called corn liquor. In these instances, the kidneys may actually kick back in and start back working. The signs and symptoms of kidney failure include dyspnea, which is a shortness of breath, or fluid retention, which is usually seen in the feet and ankles, maybe even in your hands and around your eyes. You may also experience fatigue or confusion, or a pain or tightness in your chest. If you do experience any of these, you need to see a doctor as soon as possible. Your doctor may do a series of tests, which may include a CT scan of the kidneys. He may monitor your lab results or do a kidney biopsy to determine if you are indeed in kidney failure. If kidney failure is the diagnosis, one of the most common treatments is hemodialysis. In hemodialysis, an artificial kidney is used to replace the function of the non-functioning kidney. The hemodialysis patient dialyzes via a hemodialysis machine 3 times a day for no shorter than 2 hours per day. The actual time is determined by your physician and by your size and weight. Before starting hemodialysis, an access is placed in the patient while he or she is still hospitalized. Now, one form of access is a graft, which is made from foreign material that is actually implanted in your arm or in your legs. Another is the fistula, which is joining of your own artery and vein, your own artery and natural vein for cannulation. In either access, the patient is stuck twice per day. The hemodialysis procedure is continuous. One needle pulls the blood out of the patient and takes it to the artificial kidney to be cleaned and remove excess fluid, while the other needle returns the blood to the patient's system. And this goes on throughout your 2 to 4 hour treatment. Kidney failure can be prevented if detected early. We can also prevent it by getting our blood pressure and our blood glucose levels under control. This puts less strain on the kidneys. A heart-healthy diet is also helpful. But remember, having kidney failure is not the end of the world. Many people live long lives with the help of hemodialysis, and eventually some get a kidney transplant, which is not a cure, but yet another form of treatment. If a kidney transplant is received, we may have to remember that indeed a transplant is not a cure. It is another form of treatment. There are many drugs and steroids that have to be taken several times a day to keep this transplanted kidney healthy and working. The main idea is prevention. Prevention is the key. We must take our medications prescribed by our physicians and be knowledgeable about our health and diet. See your doctor regularly and take charge of your health.